Okay, good day to everyone. Johnny Balmeo here, your instructor for this subject. NCM 120, or also known as the disaster nursing. And today we're going to discuss at the same time demonstrate to you how to perform lifting or dragging the victim. Okay, so yeah, without further ado, let's start this one. Patient lifting or moving, it's a very critical skills na dapat meron ka. Okay? And if you are a first aider, or if you work as a part of the EMS, an EMT, or a paramedic, okay, it is a routine procedure. Okay, but if you are a nurse working in a hospital, baka mabigla ka because iba yung ginagawa natin sa may hospital, iba yung ginagawa natin in the community, or should I say, ginagawa natin outside the hospital. Okay, so if ever that you wanted to become an EMT, part of the EMS, or a paramedic, okay, you need to consider two primary factors. Okay, number one, how to move the patient while protecting them. Okay, and also, how can we perform this one without causing further injury? And then the second one is how to protect yourself as a first aider. Okay, always remember this one. Lagi ko sinasabi ito sa mga estudyante ko. Okay? Prioritize yourself. Paano ka makakatulong kung ikaw mismo is mababagsakan, wag naman sana, or kung ikaw mismo, your health will be put at risk. So, always prioritize yourself. But at the same time, of course, yung victim din natin, i-prioritize din po natin. Okay? So, in doing the lifting, have a plan for patient lift. Okay? Tandaan natin, this skill, okay, it being improved, okay, through the practice. So, habang ginagawa mo to, as time passes by, napapractice mo to. But always remember that it requires what? Quick thinking skills. It requires critical thinking skills. Mabilisan tayo rito, no? Okay? Paano kapag nangyari ito during the emergency situation, paano gagawin mo? Okay, so kailangan talaga natin dito mabilisan tayo. Quick thinker po dapat tayo rito. Okay? And also, all respondents must be on the same page when moving such a patient. Kaya kailangan yung magiging kapartner mo rito, mga kasama mo rito, you are working on the same boat. Okay, what else? Pre-lift plan po natin, number one is, you must know what is the patient's weight. At the same time, alamin mo rin, ano ba yung capacity mo, yung ability mo, yung limitations mo. Baka naman kasi sobrang bigat ng pasyente mo, how will you able to lift that patient? Although there are different ways naman para ma-lift natin siya, pero paano kung nag-iisa ka? Of course, lifting pa ba gagawin mo? Kung kaya mo naman i-drag yung patient mo, dragging na lang ang gagawin mo. Pero kung sa tingin mo mahirap talaga, you need to ask somebody else. You need to ask for an assistance. Okay? What else? Communicate the plan clearly. Kaya nga sa mga lifting, especially kapag you're working as a team, meron tayo ditong team leader. Si team leader nagsasabi sa inyo kung ano yung gagawin, ano yung procedures na gagawin, and paano rin kayo magkakasabay-sabay. Meron tayong tinatawag dito na command. Okay, mamaya papakita ko sa inyo paano ba itong mga command na to. Okay, usually guys, ang leader natin, like for example, dito sa may picture na nakikita ninyo rito, usually guys, ang leader natin nasa may head part ito. Okay, at siya rin po yung nagbibigay po ng command. Ano ba yung mga command na yan? Well, marami. Okay, like for example, ready to lift. Okay, ready to load, ready to unload. So those are some of the commands. Mamaya makikita rin natin yan sa may demonstration na gagawin po namin. Okay, what else? What lifting equipment is available? Ano ba yung mga available na equipment na pwede natin gamitin para mapadali yung trabaho natin? Available ba ang stretcher? Available ba ang wheelchair? Paano po pagka hindi available yung mga yon? Stop na ba tayo sa may paglilift or sa may pagdadrag? Definitely no. Okay, tandaan natin, nursing is an art. Okay, so we improvise things. Okay, what else? What's the response time for the nearest bariatric BLS unit? Matatagalan ba sila? May malapit ba? Ano pa? Can the patient be lifted safely? Pwede ba nating buhatin yung patient? Yes. Paano sir kung hindi? Like for example, ang pasyente natin suspected na meron pong back injury. So paano gagawin natin doon? Diba? Okay? So, ililift pa rin ba natin? Well, there are many factors that we need to consider there. Okay? So, paano kung di natin pwedeng ilift? Baka naman po pwede natin i-drag yung patient. Okay? What else? Once the patient is lifted, okay, what is the best route to the ambulance? Okay, makakapunta ba yung ambulance sa atin? If ever na nakapunta yung ambulance sa atin, makakalabas ba? Like for example, gumuguho yung isang lugar. Okay, tapos yung pasyente, dinala mo sa may malayong lugar. Okay, no, dapat kailangan mag-size up ka rito. And be sure, what else? Be sure na humanap ka ng safe zone. Doon mo ilalagay yung patient. And at the same time, dapat accessible yun for the ambulance. Okay? Ano pa? Okay, how will the rescuer move a patient sitting in a vehicle or difficult or limited access position? Katulad na nakita sa may picture na to. Okay, as you can see here, ayan o, vehicular accident. Paano mo mailalabas yung patient? Ang hirap, di ba? So, kailangan dito, available yung mga gamit natin, mga heavy equipment natin, para ma-remove natin itong mga yan. Okay, yung pintuan na yan, or kaya naman, yung mga gumuhong building, okay, paano gagawin natin dyan? Kailangan available yung mga equipment. Okay? And also, what if the initial plan does not work? O nga, no? Paano? We'll always remember, have a plan B. So, paano if plan B does not work? Have a plan C. Kung maglala, napakarami ng mga alphabet natin. Always have a backup plan. Okay? So, prepare for patient leap. Always remember this one, guys. Okay? Kung paulit-ulit mo na itong ginagawa, ma-develop na rito ang iyong muscle. Okay? So, your musculoskeletal injuries, very common po yan sa atin. Pero sabi ko nga sa inyo, habang ginagawa mo ito, nalilesen natin yan. Or should I say, habang napapractice at saka nagagamit mo yung mga muscles mo, okay, we can prevent those things. Okay? So, emergency moves, lifting, generally speaking, guys, hindi mo pwedeng i-lift, hindi mo pwedeng galawin ang pasyente, especially if it is a victim of a vehicular crash. Okay? Because there's a possibility na ang pasyente mayroong back injury or spinal injury. So, paano gagawin namin dun, sir? Gumuguho na po yung building. Marami pong mga sasakyan na nagdaraanan, hindi pa ba namin bubuhatin? Well, okay, merong mga factors that we need to consider. Always remember these three things. Okay? You must move the person to protect him or her from immediate danger. Like, for example, sasabog na yung building. Okay? So, anong gagawin mo? Hindi mo ba i-save? Ano ipa-prioritize mo doon? Okay? Of course, prioritize mo yung health. Sir, paano po pagka nagkaroon po ng further back injury, at least na-save mo yung tao. Okay? What else? You must move the person to reach another person. Okay? Baka kasi doon nagpatong-patong na yung mga body nila, and nakikita mo merong mas nangangailangan doon. So you have to move yung mga patient na nandito sa may harap that act as a hindrance. Okay? So kailangan ma-reach mo yung another patient. Okay? And also you must move the person to give proper care. Ang hirap kaya, mag-CPR tas nakadapa ang patient. Yes! Ang hirap nun. So, kailangan mo talagang i-move yung patient po natin. Or should I say, the victim. Okay? What else? Preparing to lift. Okay, if you mass move a person in an emergency situation, ang goal po natin dito is what? Without injuring yourself or causing additional injury dun po sa may victim natin. Okay? Again and again, sabihin ko po sa inyo ito. Okay? Always prioritize your health. And then, next po yung victim. Okay? Ang hirap kung ipa-prioritize mo is yung victim. Bakit? Paano kapag if your health is at risk, ikaw ang unang nabagsakan. So, ano mangyayari? Isa ka sa magiging victim. Diba? Okay? So, the following video that I'm going to show you guys, following procedures, isa lamang ito sa mga common emergency moves, lifting or dragging na ginagawa po natin. It can be done by 1 person, 2 person, 3 person, and even 4 person. Okay? So, these procedures, disclaimer lamang po, this procedure may vary or it may depend po doon sa may reference na ginagamit po natin. Like for example, ang reference po ninyo for the lifting is Kosher, book ni Kosher, Fundamentals of Nursing. So, iba yung tinuturo rin kasi sa hospital setup yun. What else? Sa mga bumbero natin, meron din silang set of skills or should I say set of procedures when it comes in lifting and moving the victim or patient. So, it may vary, pwede pong mabago. Okay, what else? If you are a Red Cross, ang ginagamit natin dito, yung manual ng Red Cross, coming from the American Heart Association, okay, or kung ano man yung reference, pwede po talaga magbago. Okay? So, yung makikita natin, or should I say, yung papakita namin na video sa inyo, the demonstration, okay, po pwede pong iba ito sa mga procedures na nakita ninyo. Again, it may change depending on the reference po na gagamitin natin. Okay? So, what else? The situation will dictate which move you should use. So, nakadepende rin po yan dun sa may situation po natin. What kind of emergency yung nangyayari? Okay? Tsaka, ilan ba yung available na rescuer? Ngayon, kung mag-isa mo lang, of course, mag-isa mo lang nabubuhat. Kung dalawa naman kayo, mas mapapadali yung trabaho. Ngayon, kung mas marami, better. Okay? So, yeah. Without further ado, let me just show you, okay, some of the demonstrations na ginagawa natin. Okay?
Good day everybody, we are here to discuss and demonstrate the different types of lifting, carrying and dragging techniques for NCM 120 or also known as the disaster nursing. Together with us are the College of Nursing students that will be helping us in the demonstration.
Okay, the first skill here is what we call the lover's carry. Okay? So for the lover's carry, pwede ito sa mga patient natin na semi-conscious or unconscious. So, kneel to the patient, then cross natin yung kamay. Okay. Then there are different ways, by the way, para ma-lift natin yung lower leg. This is the first one. Okay? And then the second one naman, all you have to do, insert your hand, okay, dun sa main back of the knee. And then that's it. Okay? Then make a base, a wide base. Yan, as you can see here. Next, insert your hand at the shoulder and then prepare to put the patient or the victim on a sitting position. 1, 2, 3, and that's it. Then use your thigh, okay, para maging resting ng body ng pasyente natin. And then as you can see here, hand placement, right to left and left to right. Then prepare to lift the victim. Then isagko mo yung paa mo. Okay. Hawak dun sa may belt strap. Okay, let's have here a ventral view. Have a C-grip dun sa may kamay ng pasyente or ng victim, and then pasok ka. Then punta ka dun sa kanyang side. Ayan. Iupo mo yung victim. Simultaneous natin itong ginagawa. Iupo mo siya dun sa may thigh. Place the hand of the victim dun sa may shoulder mo. Then, using your left hand, ready to lift the victim. Okay, and there you go. This is what we call the lover's carry. Then, sa may pag-unload, okay, reverse lang ang gagawin natin. Okay? Kneel with your right leg na nakatayo. Nakataas. And then, slide natin yung victim. This is how we unload the victim. And then, ihiga na natin. Ang lover's carry, pwede ito sa mga malalayong lugar, malayo ang lugar, long distance. Pwede rin po ito sa may short distance. But this one is very applicable for the short distance. But for the fireman's carry, fireman's carry is very applicable sa mga malalayo. Okay, long distance. So, kneel to the victim, and then katulad din sa ginawa natin kanina, okay, put the arms across the chest. Okay. Next, yung kanyang lower extremity, make a base here. Ayan, isa-separate mo lang yung yung kanyang feet. Then insert. Pag yung insert tayo, katulad ng discuss ko sa inyo before, okay? Nakaganyan ang pagpasok, then ganun. Okay, para sa ganun hindi magasgas yung back of your hands kapag ka insert mo, lalo kapag ka rough yung flooring natin. Okay, next, prepare to lift the victim. Again, yung tinuro ko sa inyo kanina, left to right and right to left. Okay, yung paghawak dun sa may kamay ng victim. And then prepare to lift. Then, saggo mo yung paa mo. Okay, have your victim rest on your body if it is unconscious. Okay, ganoon din kapag kasi may conscious. Mas madali yan, of course, kapag conscious ng victim natin. Then, have a C-grip dun sa may kamay ni patient. And then, pasok ka. For the fireman's carry, this one is applicable for the unconscious victim. Okay? And there you go, pasok ka dun sa ilalim. Ang problema nga lang dito, medyo naka-bend yung katawan. And then, take their lower extremity, yung thigh ng victim, and then there you go. Okay, as you can see, naka-cross. Pwede mo hawakan ng dalawang kamay, o pwede ring isa. Kung isang kamay lang ang nakahawak, yung isang mong kamay panghawi. Okay, as you can see, mas madali itong gawin in comparison to the lover's carry. This is how we unload. Again, reverse lamang. Okay, kung paano tayo nag-unload dun sa may una nating procedure, sa may lover's carry, ganun din po rito, no? Okay, i-slide natin yung victim while yung right na lower extremity mo is medyo nakatayo. That act as what do you call this one? As a sandalan ng victim. Okay, support, I mean. Okay, and there you go. Okay, next one, we have here the pack strap carry. Okay, ang pack strap carry po natin, it's almost the same with the what do you call this one? Piggyback. Okay, pero medyo may konting variation. The backstrap carry is applicable for the unconscious, o pwede rin po sa may conscious. Then have a base, ayan, nakakross na yung kamay. Then insert yung ating kamay. Then prepare to put the victim on a sitting position. Support the back, nang sa ganun hindi bumagsak. And then prepare natin yung victim. Okay, change natin yung position. Okay, so from, as you can see, from supine to sitting, to standing position. Sagko. Okay. Let's have the ventral view. Okay. C-grip on the arm of the patient. Sa may wrist, ka nakahawak, support pa rin yung body. And then dito, lilipat ka ngayon sa may harapan ng victim. As you can see, okay? So, meron tong mga iba't ibang variation, ano, pwedeng nakadiretso yung kamay ng victim, pero mas magandang gawin po ito. Okay, nakakross yung kamay ng victim. Okay, hindi siya masyado mapipilayan dito. Then, pwede ka nang maglakad, dala-dala ang victim. So, how to unload? Again, reverse lamang ang gagawin po natin. Okay, reverse lamang kung paano mo siya binuhat, re-reverse mo lang. Then, let the victim slide dun sa may thigh mo. And there you go. Okay? Higa mo na yung victim. And then, ganun lang siya kadali. Okay? Okay, next. And this one naman, ito tinatawag po natin na shoulder pull. Okay, from the name itself, you're going to pull the victim using what? Okay, shoulder, hindi po, sa ilalim ng shoulder nila, ano? Okay, gawing armpit. Okay, cross the arms, this my chest, but as you can see here, hindi po natin ginalaw yung lower extremity. For what reason? Because we're going to drag the body of the victim. Okay? This is the variation 1. Tignan ninyo yung gagawin ng ating responder dito, ng ating first aider. Okay? Gamit ang tuhod, nilalakad niya at dinadrag niya yung victim. And then tignan yung ginagawa niya, hinahawi niya yung daan. That is the variation 1. This one is applicable sa mga mabababa yung space. Ngayon, kung medyo mataas ang space, ito mas magandang gawin. Okay, variation 2. Mas madali kasi itong i-drag yung katawan ng victim. Okay, and there you go. That is the shoulder drag, shoulder pull or shoulder drag. Next one, we have four-handed sit. For the four-handed sit, kailangan po natin dito ng dalawang rescuer. Ayan. Yung abang yung isa, nagko-cross ng kamay, doon sa may chest, yung isa naman, gagawa ng base for what? Okay, for the lower extremities. Put both of your hands at the back of the victim. Then, simultaneously, taas ninyo yung thigh ninyo. Okay, para maging sandalan ng victim. And then, prepare to what? Sit the victim on your lap. Okay, and then yung kamay ng victim sa may shoulder ninyo. Okay, show your hands. Okay, ganito kasi, this is how you will insert your hands dun sa may thigh ni victim. And then, prepare to lift. There you go. Kapag ganito, kailangan meron tayong komanda. Prepare to lift. 1, 2, 3, lift. Okay, we will now move on to the unloading. Kapag nag-unload kayo, since dalawa kayo rito, merong isa na nagsasalita. Prepare to unload. Okay? Next. Ayan, we have here the human crutch or tinatawag po natin na two-person drag. So from the name itself, we're going to drag the body of the victim. Okay? So nakadepende po itong procedure na to kung semi-conscious, okay, or conscious or unconscious yung victim. Okay, so again, sitting position, nakasupport sa likod, yung inyong legs. Okay, next, iupunin nyo yung victim doon sa inyong thigh. Put the arms of the victim to your shoulder. Then prepare to lift. Again, kailangan ng command po natin dito. 1, 2, 3, lift. Okay, this one is for the semi-conscious. Pag semi-conscious, all you have to do, drag their feet. Ayan, dinadrag mo para makalakad siya. Okay, left, right, left, right. Meron din tayong command na binibigay dito, okay? Left, right, left, right. For the unconscious, all you have to do, drag the whole body. So, mas madali po yung unconscious. Next one naman, okay? We have two-handed sit. Kung kanina meron tayong four-handed sit, we will now move on to two-handed sit. Okay, kinaalala kanina, two-handed sit. Nakaganyan. Okay, ito naman, two-handed. Okay, again, support. This one is very suitable for unconscious victim. Yung four-handed, for conscious victim or semi-conscious. Paupuin natin dun sa may thigh. Then show your hands. Okay, that's how you're going to, what? Insert your hands. And then interlocking. Prepare to lift. 1, 2, 3, lift. Prepare to walk. 1, 2, 3, walk. Okay, nakikita nyo, hand placement sa likod. Okay, next one, we will move on to the hammock carry. For the hammock carry, kakailanganin natin dito ng tatlo na first aider. Okay? So, ayan. Put the arms of the victim on her chest. Okay? Count 1 to 3. 1, 2, 3. You, number 2, go on the other side. Okay? Sino po ang nagsasalita ron? Yung leader. Asan yung leader? Nasa may head part. Okay? Next, prepare to kneel. 1, 2, 3, kneel. Show your hands. Okay? Then, if perform interlocking, that's how you're going to interlock your hands later. Okay? Then prepare to insert. 1, 2, 3, insert. Okay. Next, prepare to load. Tandaan na, simultaneous kayo rito. 1, 2, 3, load. Pagka nag-load kayo, dapat itataas nyo na rin yung tie. And then, prepare to lift. 1, 2, 3, lift. Okay, and then prepare to walk. 1, 2, 3, walk. Tandaan na nagsasalita rito yung leader. Prepare to unload. 1, 2, 3, unload. Okay. And that's it. Okay, ganun lang kadali. Okay, tandaan natin nakasalalay dito yung synchronization ng team ninyo kay team leader. Kaya dapat marunong magbigay ng command si team leader. Okay, I think this is the last one. This is the stretcher lift. Tinatawag din po natin ito na 3-man carry. Pero mas kilala siya as stretcher lift. Okay, so usually ginagawa po natin ito kapag malalapit lamang na malalapit lang yung pagdadala natin ng victim. Show your hands. Okay, you're going to insert those hands. Okay, sa may victim po natin. Then insert. Next, prepare to lift. 1, 2, 3, lift. Okay, again, simultaneous. Itaas natin. Ready to clip. 1, 2, 3, clip. Okay, ganun po ang pag-clip ha. And then, ready to stand. 1, 2, 3, stand. Okay, stand or lift. Okay, and then prepare to walk. And that's it. Ganun lamang po kadali ang pag-lift. So, yung iba rito, hindi na namin madidiscuss sa inyo such as the chair carry, the blanket drag. Tuturo na lamang namin sa inyo yun on the spot. Okay? Kasi yung mga yun, madali na lamang yun gawin. And also, nakadepende po yun sa materials na meron po tayo. Okay? So, ganun lamang kadali itong mga procedures na to. If you have some questions, okay, of course, you can send me a message, okay, or put it on the comment section. Okay? Or if you have some, what do you call this one? Some requests, okay, na mga ituturo. Okay, so yeah, that concludes everything, guys. Okay, ready for the return demonstration?